Hello, this is Dr. Richard Fleming, and today is Saturday, August 22nd, 2020. One of the questions I keep receiving from a number of people is why aren't doctors able to prescribe medications for COVID-19 based upon what they think the patient should receive? The answer is a rather complicated one, so I want to walk you through the process of becoming a doctor. When people want to become a doctor, there's a series of courses that they have to go through as undergraduates, and then they take the GPA of those scores along with recommendations and a test that they have to take to enter into medical school known as the Medical Knowledge Assessment Test, or the MCAT test. It's changed over the years, but the basic idea is to determine how much of the information from the basic sciences they remember prior to getting into medical school. The process of going through medical school is a rather long and lengthy one, and it's not inexpensive to do so. Most students have a 4-year program, but some of us get an additional year of research, and some other individuals will combine their MD PhD program, turning it into a 7-year period of study. Following that, if you really want to practice clinical medicine, you need to take additional training. And that begins with that first year called the internship year, followed by the remainder of the residency. And if you want to subspecialize, as cardiologists like myself do, you have to get into a fellowship and then a subspecialty if you want to do things like nuclear cardiology. Those additional 6 or 7 years tag on to the 4 to 5 years that you already have, plus the 4+ years of undergraduate and graduate training that you might have just getting into medical school. When all that's said and done, for a physician to be taken seriously, they really need to take their boards in their areas of residency and fellowship to be taken seriously. It's rather hard to justify going to see a physician who hasn't become board certified, at least at some point in time in their life. And with that information, physicians will then apply to each state to obtain the medical license. Now, that is not what makes them a physician. What makes them a doctor is the fact that they graduated from medical school and the additional postgraduate training of internship, residency, and fellowship. But each state has a different set of rules, and they have people that sit on their medical board. That medical board determines whether you're allowed to practice medicine in their particular state. Now, on that board, there's usually some physicians. There's usually other individuals, however, that are not medically trained. Frequently, this amounts to the lay public, nurses, theologians, and attorneys. And therein really lies much of the problem. The determination about whether you have a license to practice in any given state is determined by a board of people that didn't go through the same training you did, making decisions about whether they want to allow you to practice in their particular state. And who controls that board? If you didn't already guess, and I'm certain that many of you didn't, it's the governor of that state, because everybody on that state medical board serves at the pleasure of the governor. And who are the governors? Well, they are the elected officials. And except for a couple instances, most elected individuals are attorneys, lawyers, who took that pathway to get into politics to get real control and power. So the end result is that the people that are determining whether doctors get to practice medicine the way they've been trained to practice are the attorneys. That makes as much sense as me as a doctor telling attorneys how to practice law. Oops, wait a minute. I'm also an attorney. And I can see the fallacy of allowing doctors to tell lawyers how to practice law. It's bad enough as it is. The difference between law and medicine, by the way, is that while lawyers and judges can really goof up your life, and with the death penalty, they can take your life away, none of them have the unique ability to know how to treat you to keep you alive. And lawyers and judges get to manipulate the law for the outcome that they want it to be. Doctors, on the other hand, have to depend upon science, medicine, skill, and knowledge. We don't get to just simply wave a magic wand and decide if we want a particular outcome, it's going to happen. No, we have to depend upon the science. So you have a group of people, the lawyers, who are getting elected to offices, and I think there's 11 governors up for re-election in 2020, who get to select who they want to serve them in their states. And those individuals get to threaten doctors whether they get to practice in that state or not, based upon whether they follow along and do what they're told to do. There's really not a heck of a lot of point in people going to medical school if in the end they have to do what they're told to do. That's called indentured servitude, not practicing medicine. So if you want to know why doctors are not prescribing the medications for COVID that many of them claim that they would like to prescribe, it's because they haven't been given a choice. Sure, the FDA says if a drug's approved for something, it's at the discretion of the physician to determine what they want to use it for. That would appear to be the way it's supposed to work. And you would think that going to medical school and completing that training and certifying under those boards would be satisfactory to determine who practices in your state and how they want to practice. But in the end, it's been left up to the lawyers because everybody has gone about their own business and the lawyers have gone about theirs of acquiring more power and control. Ask yourself, should the elected lawyers that are now governors and controlling the medical boards in the state where you're at really be the people who determine the type of medical treatment you receive? Or should it be the doctors?